My name is Dr. Omar Ali. I'm an interventional and structural cardiologist here at Mid-Michigan Health. A valve, like any other valve, is a device that allows fluid to leave in one direction. To think about what valves do, you first of all have to understand, what does the heart do? The heart is basically a muscle that pumps. Its purpose is to move blood. So the heart is composed of two sides, the right and the left. Each side has an upper chamber and a bottom chamber. All of these chambers and all of these sides are separated from one another by valves. This flow of blood is regulated and made sure to go in one direction. And when you have a valve disorder, it can either be too leaky or it can be too tight. Sometimes it can be both. Whenever you have non-laminar or non-smooth blood flow, and there's turbulence in the blood flow, one can hear it, and that's what causes a murmur. So if you have a murmur, you're not going to be able to hear it. Your doctor will hear it if they put their stethoscope on your chest, and they will probably initiate a workup as to figure out why is it abnormally flowing. And in the vast majority of cases, it doesn't mean anything. But in some cases, abnormality of valve functions can lead to louder murmurs, and they could signify disease. If there's an abnormal murmur or abnormal flow, that should initiate a workup in the form of an ultrasound. And the ultrasound is a very sensitive and a very accurate way of figuring out how the valve is working, how is the blood flowing through that valve, and how that overall valve function or dysfunction is affecting your overall heart function. The key in valve disease is diagnosing it early, following it very closely with ultrasound and other modalities, and then coming up with a plan. And what that plan is really depends on the patient. We have a very comprehensive valve center. We would sit down amongst multiple specialties and hammer out a plan that suits you the best.